Hello everyone. Today, we'll explore the medication Rizatriptan, which many might recognize under its brand name, Maxalt. As always, this discussion is for educational purposes, and if you have health-related questions or concerns, always consult with a medical professional. Description: Rizatriptan, popularly known by its brand name Maxalt, is an oral medication that belongs to a class of drugs called triptans. Its primary function is to treat migraine headaches. Rizatriptan works by narrowing the blood vessels around the brain, helping to alleviate headache, pain, and other migraine symptoms such as sensitivity to light or sound and nausea. It is essential to understand that while Rizatriptan helps treat an ongoing migraine attack, it does not prevent future migraines or reduce the frequency of attacks. Warnings: Rizatriptan should not be used to treat common tension headaches or any headache that seems different from your usual migraine headaches. Do not use Rizatriptan if you have used an MAO inhibitor in the past 14 days. This combination could lead to a dangerous drug interaction. Furthermore, the use of Rizatriptan has been associated with heart attack symptoms in some people, so individuals with certain risk factors should exercise caution before taking this medicine. Before you start taking Rizatriptan, there are several aspects to consider. Inform your doctor if you are allergic to it or if you have any history of heart diseases, high blood pressure, liver disease, circulation problems, or any headache that feels different from your usual migraine. It's also crucial to discuss with your healthcare provider if you're pregnant, planning to become pregnant, or are breastfeeding. This medication might affect the fetus, so it's essential to assess the risks and benefits. You should not take Rizatriptan if you have any form of coronary heart disease, angina, chest pain, blood circulation problems, lack of blood supply to the heart, uncontrolled high blood pressure, severe liver disease, or a history of heart attack or stroke. Side effects: as with all medications, Rizatriptan can cause side effects. Some individuals might experience dizziness, drowsiness, feeling tired, or nausea. While these are some common side effects, some people might experience more severe symptoms, such as heart attack symptoms. If you notice chest pain or pressure, pain spreading to your jaw or shoulder, nausea, sweating, or a general ill feeling, it's imperative to seek medical attention immediately. Similarly, if you experience sudden and severe stomach pain, bloody diarrhea, seizure, or symptoms of serotonin syndrome, agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, or diarrhea, it's vital to get medical help. Interactions: Rizatriptan might interact with other medications. Be sure to inform your doctor about all medicines, supplements, and herbal products you are currently using. Especially notify your doctor if you are taking any antidepressants, other migraine headache medicines, or a MAO inhibitor. Dosage: the appropriate dosage is crucial to ensure the effectiveness of the medication. Always follow your doctor's directions when taking Rizatriptan. The standard dose for adults is typically 5 mg or 10 mg, which can be repeated if the migraine comes back, but ensure there is at least a 2-hour gap between doses. It's essential never to take more than 30 mg of Rizatriptan in a 24-hour period. As with any medication, it's crucial to ensure you're taking the correct dose and to avoid altering your dosage without consulting with your healthcare provider. Avoid: while taking Rizatriptan, it's recommended to avoid drinking alcohol as it might increase certain side effects. Moreover, given that dizziness and drowsiness are potential side effects, it's advisable to avoid driving or operating heavy machinery until you know how the medication affects you. FAQ: a common question is about the age limits for Rizatriptan. Presently, Rizatriptan is not recommended for use by anyone younger than 6 years old. Always consult with a healthcare provider for any specific queries about this medication. Closing: that concludes our overview of Rizatriptan. Remember, this information is for educational purposes and should not replace professional medical advice. Always seek guidance from a healthcare provider with any questions or concerns. Thank you for tuning in.